Hello everyone. So today we are going to talk about review for module 6. So this is a real important review for all of us because this is our final review class and this exam has 14 points instead of 10. So every question has more weight as compared to our previous modules. And because we are not facing each other for this class, so I just don't have an idea what exactly you guys expect from this review. But I will try to do it in the same fashion with we have been doing it for all our previous modules, that I will go over all the 7 PowerPoint slides one after another and try to highlight some of the key points which you should know before you appear for the exam. To get maximal advantage out of this PowerPoint, out of this presentation, I strongly urge everyone to go through the PowerPoints once before because it's a short presentation and we can't get over all the modules, all the PowerPoint presentations in the same detail as we have been discussing in the class. So if you go through them once very quickly, I am pretty sure that this will be of great use. And I'll be highlighting things which will be extremely important from our exam perspective. So I want you to pay a lot of attention. And if you have any confusion, just feel free to email whenever you watch this module and before the exam next Friday. Great. So let's make a start now. So these are our 6 big objectives for this class, that we want to talk about addictive behavior, dependence, we want to talk about psychoactive drugs, we want to talk about alcohol and discuss tobacco at the end. So let's try to discuss addiction and dependence at the beginning. So if you just think about the term drug, it's a chemical substance which alters physical or mental functioning of our body. And if you look at psychoactive drugs, these are the drugs which go and work on our mind and affect our mental status or consciousness. So our main focus is about psychoactive drugs. And if you think about its effects, we take psychoactive drugs for most of the times it's short term effects, which is relaxation and excitement. And as far as its consumption in a long run is concerned, it mostly have all kind of negative effects on our health. So let's make a distinction between addiction and dependence. And I want to go over those definitions very carefully because you will find questions about addiction and dependence in your exam. And I want you to distinguish between them very clearly because these terms are very closely interrelated. So, if you talk about addiction, you need to understand it is a disease with potentially no specific cure. So it is a disease which affects an individual who is taking a certain drug. And if you think about dependence, it means the term self explains itself that you have physical as well as mental dependence on the drug, which means to carry out your normal processes, physical processes, for example, eating, sleeping, you need drugs. As far as mental dependence is concerned, in order to concentrate or to memorize things, you just can't work without a drug. So if a drug is hampering your physical needs and mental needs, it means you are dependent on it. But still, there is no organic disease which is developed. And if that disease starts developing, it means your dependence is changed into addiction. So this is just the thing which I've already highlighted, that if in addiction there is a structural change which hampers the functioning of the brain. Now, what are the signs of addiction? I think some of things are important, for example, cravings, abuse, but I want to talk about the last two. And I just want to start the pointer to make it more clear. Okay, so let me just a sec. So I want to talk about this particular aspect, which is dependence, withdrawal, and relationship issues. And also, I want to talk about interference with normal life functions. So please remember, if it is hampering your daily life, the functions of your daily life, which is related to your job, your school, your relationships, this is addiction. You need to understand this interference with normal life functions if you want to think and talk about addiction. Now, dependence, I've already talked. It talks about physical dependence and it talks about psychological dependence. However, addiction, I have already explained that this is about relationship, schoolwork, and jobs. Um, we can skip this. Some of the factors which are involved in addiction includes genes, exposure, and environment. However, genes play a big role which will be helped by a change in the environment. This is just a good distinction to summarize between dependence and addiction. If it is needed to perform your normal activities, both physical as well as mental, which sorry, yeah, which means it's dependence. And if it is hampering the normal functioning, which is in terms of school, if it's term of relationships, if it is in terms of your job, then it means that it is addiction. So I guess we have talked a lot about the difference, and I hope you'll be able to answer the dependence and addiction question in our exams. These terms are important. Specifically, alcohol abuse, which means that if your pattern is harmful to both you and others, it means you are abusing alcohol. Blood alcohol concentration, extremely important. It's a measure of intoxication, and we will discuss about it in just a bit. Cirrhosis, the final harmful effect of the liver once you have development of fibrous tissue. Please remember, this is the final stage of alcohol, um, the final effect of the problems associated with alcohol. So first you have fatty liver, then you have stenosis, and the final stage is the formation of fibrous tissue, which is cirrhosis. Environmental tobacco smoke is important, and we will discuss it again after some time. However, please remember, as of now, it is the second hand smoke or the smoke which is there in the environment which you are indirectly taking. And then all the effects of alcohol on fetus during pregnancy, which results into decreased birth weight, miscarriage, and all the stuff related to child's developmental status are included in the spectrum of disorders, which is fetal alcohol spectrum disorder. Right, so we are done with our first class. I understand that this is um, a bit long as I would have expected, but I just want to go over it slowly and so that you'll be able to revise most of the things. Now, let's talk about um, Just a quick second. I don't think this is the right slide. All right, this is the one which I want to talk about. This is our second class. So this is just a revision of addiction and stages of addiction. So we have already talked about this. We will want to talk now about psychoactive drugs. So drugs that alter mental functioning are psychoactive drugs. And from this side, I just want everyone to remember that we want to talk in detail about marijuana. Sorry, I just want to start the pointer to make sure that we are discussing things clearly. Okay, so marijuana is a kind of a drug which is being used most of the times as an illegal substance in the United States. So this is a drug which has been consumed in humongous amounts here. And this is just a graph which shows that most of the times this drug consumption is high in this age group. It's people start taking it at an early stage, but between 15 to let's say around 29 years, this age group consumes drugs most in the United States. And you can see in green everywhere there is marijuana. So it has a really high proportion of the total use. Now, this is a very interesting slide. It tells us the difference between misuse and abuse. Now, I just gave this example in the class and I want to talk about it again. If you are using a drug which you have been using as a medication more than the normal dose, more than the prescribed dose of the physician or whomsoever has prescribed you, that's misuse. However, if it's causing harm to your health, to your safety, relationships, and jobs, it means that you are abusing the drug. And that's a very minute difference, I guess. If you are just using it in increased quantities to have an advantage, but it's not harming any of the things which is listed in abuse, then that's misuse. However, if the amount of drug is harming your health, relationship, job, school responsibilities, that is misuse. Sorry, that is abuse. Now let's talk about the mechanism of action of these psychoactive drugs. They all act on the brain, and synapse is the connection which is most important. Now, drugs can be CNS stimulants or they can be sedatives or CNS depressants. So I just want to highlight that nicotine, which is present in cigarettes, and we'll talk about it in a moment, is a CNS stimulant. Sorry, you take time for this to write. So it basically stimulates the central nervous system. And if you talk about this ecstasy or MDMA, it has the same effect of CNS stimulation. So both MDMA or ecstasy and nicotine are CNS stimulants. And please remember, we just want you to remember the name of the chemical composition of ecstasy, which is MDMA, and we will talk about cannabis in just a moment. So if the second term which I want everyone to remember is this cannabis or THC and benzodiazepines. So the idea is that these two are CNS depressants. So they are sedatives and they stop or hampers the flow of ions or neurotransmitters at the synapse. This is just in one word I want to highlight. Whether you are taking alcohol, whether you are taking heroin or cocaine, whether you are taking nicotine, everything works on this big reward center that is nucleus accumbens. Now, this is a classification of drug, and we will very quickly go over it. If you look at depressants, I just don't want everyone to remember all these effects. It's important that you just should know that alcohol, sedatives, and benzodiazepines, these three classes are depressants. So they decrease the activity of central nervous system. So they slow the pulse rate, they slow the breathing, they slow the blood pressure. And finally, they'll result in LOC or loss of consciousness. And you can have all the symptoms of memory, incoordination, depressed reflexes, arrest, addiction sort of things. So the idea is heart rate goes down, respiration goes down, blood pressure goes down, you feel dizzy, and you just want to sleep. These effects are opposite to the ones which we have just talked. All these amphetamines, cocaine, and MDMA, these all three are the CNS stimulants. So it increases heart rate, opposite to the one, it increases blood pressure, and it gives you a feeling of high sort of thing. It increases respiratory rate, and then you have nervousness, insomnia because you're so excited you just can't sleep. You have reduced appetite, you can have seizures at times, and because of vasodilation you can have stroke. So there is vasodilation, your blood vessels dilate, blood flows very fast, you can have headaches, the vessels may burst out. So all these increased effects, fast stimulation, increased iron flow through the brain is about CNS stimulants. As far as opioids and cannabis is concerned, it has a mixed set of effects. For example, if you have heroin, if you have morphine, these all have kind of effects which are relieving pain and euphoria. So opioids and cannabinoids have mixed features. So they have features of both stimulation, sometimes help, sometimes depression. So it depends that they have features of both. So I just want everyone to know that heroin and morphine are the two important opioids. And in this one, I just want everyone to remember about marijuana, although we talk about it. So marijuana, the most commonest proportion of drug taken in the United States. And as far as hallucinogen is concerned, I just want everyone to know that LSD exists. All right, so we are done with two of our presentations. And let's move on to our third presentation. And I hope that my cursor will work now. It's working. So, three important ones I want to talk are caffeine, marijuana, and ecstasy. So caffeine is an important psychoactive drug which I want to talk about from an exam perspective. Two things here. First, it is used in tea, it is used in coffee, and it is also used in energy drinks and soft drinks. So I want everyone to remember that caffeine is just not limited to coffee. It is used in tea, it is used in energy drinks, it's used in soft drinks. A lot of beverages have caffeine. So this is just what I talked, a lot of sources of caffeine, so you just remember that it's not only coffee. Now, this is also important. Caffeine is not black or brown like coffee only. It is a white powder. And this white powder is basically bitter in taste. So these are two important things which I want everyone to remember. That this cursor is working stupendously slow. So this is bitter in taste, and caffeine is a white powder. It acts on adenosine receptor, and as you can see that it has a competitive inhibition with adenosine, and because adenosine, whatever function adenosine do, it just antagonizes all those functions, and that's why it's responsible for all its effects. So because adenosine is a substance which helps us to sleep, and because it replaces adenosine, so that's why we have all kind of active insomnia kind of feelings. And adenosine is a vasodilator, and that's why if with vasodilation you have headaches, and if you take caffeine, it just have vasoconstriction because adenosine is no more acting, caffeine is there, so you have kind of relief in headache if you drink coffee. All right, this is interesting thing which I want everyone to remember, that dependence is common with caffeine than addiction, and it's somehow beneficial in Alzheimer and T2DM. Again, one thing I want everyone to remember, that caffeine is a CNS stimulant, so it basically stimulates the activity of central nervous system. From marijuana, please remember this one, I've talked about it before, THC. This is tetrahydrocannabinol. So you have MDMA and you have THC. So please remember these two terms, that the chemical psychoactive substance of marijuana is THC. So whenever we take marijuana, we have a feeling of kind of euphoria. It's very common, and 50% people start before the age of 40. All right, we can skip those effects and talk straight about ecstasy. Now, the important thing about ecstasy is that it also known as MDMA. So just like marijuana is THC, ecstasy is MDMA, and it gives us a feeling of warm stimulation, well-being, and that's why we all consume marijuana. As far as negative effects are concerned, because it's a kind of a stimulant, so it increases heart rate, it increases blood pressure, it increases respiratory rate. All right, let's keep those changes and move on to our next presentation. All right, now we want to talk about alcohol. There are a lot of questions in our exam related to alcohol. It's an extremely highly consumed beverage, and I want to talk about it in quite a lot of detail. We know that a lot of people around the age of more than 12 years, 50% to be precise, consume alcohol. And the important thing as far as these numbers are concerned, that it's responsible, let me start the pointer first. It's responsible for a lot of people who are abusing it. A lot of deaths are happening, around 88,000 people are suffering. College students are consuming in real high amount, they get intoxicated, and a lot of crimes in the form of assaults and rapes are taking place because of alcohol. So these are some of the harmful effects on the society. This is really critical to understand. If we talk about alcohol in terms of a standard drink, this is 0.6 ounce of ethyl alcohol. So ethyl alcohol is the active substance which is present in alcohol, which is responsible for all its psychoactive effects. So my idea is that please remember this number 0.6 ounce, and if you convert it into ml, this is around 18 ml. So once you talk about a standard drink or one drink, sorry, it will take me just a bit of a time to write this. So if you talk about one drink, it should have zero point 0.6 ounce or 18 ml of ethyl alcohol present. So if you take this 12-ounce beer, which is around 350 ml, you have 5% alcohol in it, which is around 18 ml. The same thing is true for malt liquor, table wine. So I just want you to remember this number. This is another number which should be remembered. If you talk about men, it's 4 drinks. If you talk about women, it's 3 drinks every day, which is low risk alcohol limits by N sorry NIIIA. That's the National Institute for Alcohol Abuse and Addiction. So they consider this number 4 for men, 3 for women in one day. Please be careful once you are looking for the total in a week. For men, it's 14, and for women, it's 7. So these magic numbers 7 for women, 14 for men in a week, and 4 for men and 3 for women in a day. You should remember all these numbers so that you should be able to know the NIAAA safe limits. These are the group which should just don't drink alcohol. If you are trying to be pregnant, if you are driving, if you are taking any medications, and if you are less than 21 years in most states, so it's illegal to consume alcohol less than 21. Okay, this is another heavy episodic drinking pattern or binge drinking. So for women, it's 4 drinks. For men, it's 5 drinks. So if you are consuming more than that, you are intoxicating or binging yourself. And it's usually within 2 hours, which means that your BAC rises real quick. So I'm just revising a lot of numbers which we have talked. One standard drink is 0.6 ounce or 18 ml. For males, as far as NIAAA is concerned, it's 3 for females and 4 for males. Weekly, it's 14 for males and 7 for females. But as far as binge drinking pattern is concerned, it's 5, not 4. 5 for males and 4 for females in around 2 hours. So that's binge drinking. So these are a lot of numbers. I just wanted to remind you to be aware and remember these numbers for the exam. All right. Let's discuss. We've already talked about this. We have talked about the BAC. Sorry, I just want to start the point again. BAC is the blood alcohol concentration, which tells us 2 things: measure of intoxication. Measure of intoxication and how much blood is there in our blood. These are some important numbers that tells that how much is safe. So if you are just drinking 0.01 to 0.05, that's pretty safe. Nobody drinks here. We are somewhere drinking here. And if it is in this range, this is a medical emergency because the person gets unconscious, and above this number, people land in coma or may die. So these number 0.3 to 0.4 is a red flag sign. So that's an alcohol emergency. So what we can do to stop that, these are some of the factors that we want to drink slowly. We want to drink slowly and limit our alcohol use. Well, this is also important, that how shall we get over hangover, or how can we get rid of hangover? So these are the signs of hangover: all kind of headaches, nausea, anxiety, etc. So it will take time to get completely intoxicated, and they say that if you take 0.0 0.02 BAC, it will take almost uh, it will take almost 2 hours to completely get metabolized. So a drink has 0.02 BAC to get to get completely metabolized and get over the hangover. So if you have taken, let's say, 4 drinks, so it will take almost 8 hours to get over the hangover. And if you have taken 10 drinks, then you can just calculate it will take almost a day to get over it. These are some of the suggestions to get over hangover, and we have talked about in the class a bit. This is important. I feel that fatal dose of, we have talked about this number, 0.3 BAC to 0.4. If you have taken this, then your gag reflex is suppressed and your breathing is compromised, and it's a medical emergency. This is a good video. If you can just quickly watch it, it tells about the hazards of alcohol emergency and how important it is to get medical aid as quickly as possible. I've already talked about it. Just a quick revision, that if you think about this, fatty acid, the hepatitis, and cirrhosis, the final consequence of heavy alcohol consumption. So these are the changes. So first you have fat accumulation, then you can get infected, and finally you have fibrosis of the liver. This is also important, that as far as alcohol consumption during pregnancy is concerned, you have this fetal alcohol syndrome, and these are some of the facial features, although the other important features are, you can have my writing is horrible when I'm writing this. So you can have a miscarriage, you can have low birth weight, you can have developmental problems of the fetus. So these are some of the problems if you drink alcohol while being pregnant, because it just crosses the placenta and harms the fetus. Alright, so we are very close of getting over the presentations. I know it's quite difficult for everyone. Okay. So let's talk about tobacco. This is our last important slide, important class. So the first thing about tobacco is that it's a very big public health threat. And I want everybody to remember that this is the largest preventable cause of death, because 100,000 people in the United States each year die from tobacco consumption. This can most definitely be prevented if we just stop consuming tobacco. So it's the largest preventable cause. It's costing a huge amount of fiscal burden, $100 billion a year. Now, this is also very important. If you look at the epidemiology, you can see that all these three age groups, actually, I just did it quickly. These three age groups, they almost have equal consumption of smoking. 21, 24, 24. So there's not much difference between these age groups. So everybody between 18 to 24, no matter where you are, changing your age group, but you are still consuming high amount of tobacco. Females are consuming tobacco a bit less as compared to males. There are some racial differences, some educational differences. So it's more in American Indians and Alaska Natives as compared to the Caucasian or the Afro-American race. And as your education status increases, your tobacco consumption decreases, so they are indirectly proportional. This is very important. couple of things. One, tobacco contains nicotine, which is a highly addictive psychoactive substance, and it is a CNS stimulant. And it gives pleasure because it activates this nucleus accumbens. I've already talked about it, and it has a lot of chemicals and carcinogens which are harmful. We saw this diagram before, so it's a CNS stimulant. That's the only thing which is I want everyone to remember. It stimulates the CNS. So, I've talked in a lot of detail about the harmful effects of nicotine in the class and how it causes a lot of cancers. If you can't remember any of those, just remember about the damage to the lungs or the lung cancer. So, smoking, apart from all other effects, causing cancer of the lungs. It affects our stomach, heartburns, it affects our liver, it increases the risk of cardiovascular disease, the CVD, and it has a harmful effect on our reproductive health as well. So, this is just a recapitulation of all the diseases I've already talked about them: cancer, lung cancer, big one, heart disease, and other effects. Here I just want to tell everyone that these are a variety of forms in which tobacco is consumed. For example, chewable tobacco in the form of hookah, or it can be in the form of some kind of light cigarettes or cigars. It doesn't matter in which form you are consuming tobacco. Everything is really harmful. So the harm is it does not decrease with a change in form, because people with light cigarettes, they just tend to inhale more forcefully so that they can inhale maximum amount of smoke. So all the cancers, all the harmful effects just remains the same. I've talked about very briefly at the beginning about this environmental tobacco smoke. So it is responsible for almost 70,000 deaths. So this is really big. Many people feel that secondhand tobacco smoke is not harmful. Guys, it is actually harmful. And this environmental means that it's the secondhand. You are not smoking, but as you can see in the picture that you're talking to someone who's smoking and you are inhaling that smoke inside you, which is harmful. So it causes all kind of bronchitis, pneumonia, all these lung problems, and low birth weight in children if you are pregnant and taking secondhand tobacco smoke. So what we can do to quit smoking? Before we discuss that, there are a lot of things to return back to normal. One big thing I want to emphasize here is that if somebody asks that I've been smoking for so many years, is it gonna beneficial now? If you quit smoking at any point of time, it's beneficial. You will decrease its effects, although maybe slowly, but most definitely they will decrease. And this is a huge list that in 20 minutes your blood pressure decreases, then slowly your carbon monoxide risk decreases, slowly you can have your circulation comes back to normal in around 3 months, your lung function gonna improve, your heart disease risk gonna decrease in a year, then your cancer risk of other cancers decrease apart from lung cancer, and it took almost 10 years for lung cancer risk to decrease. So these are a lot of categories which you can read, but you need to quit smoking at any point of time, and that will be beneficial. And these are some of the alternatives which you can use. You can use chewing gums, you can use lozenges, skin patches, couple of drug bupropion which is available which you can use to quit smoking. So the main idea is that tobacco consumed in any form is harmful. If you stop smoking it, it will benefit you, and you can use these strategies to combat tobacco consumption. I guess that's the end of our presentation for all the modules. I understand that it's a long module. This video is again very long, and I apologize for that. I just want to explain everything slowly and as much as I can before your exam. If you still have any questions, the moment you want to watch the video and while you're reading, just feel free to email me, and I'll try to answer all your queries before our exam. I hope you're having a nice holiday, and I hope that everyone scores as much as they can, get a perfect score, and get a great grade in the exam. Thank you very much.